let's see. So I'm the Associate Director of the Los Angeles program of CSH. I know many of you. I think most of you know that CSH is an organization dedicated to ending homelessness. We actually provide financial support for supportive housing development, but we also do a whole range of education, training, consulting, and support for aligning systems that touch individuals that are experiencing homelessness. Our whole goal is to make the system more supportive and to help folks that are in a situation of homelessness. Sorry, I'm getting a lot of little boxes coming up on my screen. So there we go. Okay. So again, we are really always looking for new ideas, best practices, and we're trying to create partnerships that have an impact on supporting housing and ending homelessness. And we do that through training and education. We do financial support through lending. We work a lot on policy. And we also provide consulting and technical assistance. So that's a little bit about CSH. We're so happy to be able to sponsor this session today. And with that, I'm going to turn it over to Alana, who will walk us through the agenda and introduce the presenters.
Great. Thanks, CSH, for bringing this training to us this morning. You guys are such great trainers, and we always appreciate your work in this area. My name is Alana Remerman. I work at Shelter Partnership. We're a technical assistance provider and work in the areas of affordable housing and homelessness in Los Angeles County. I'm going to be kind of the MC for the training this morning. So I'll start with just a brief overview of the agenda. So we're going to do introductions, which we're just starting in a few moments. We're going to give an overview of the training's goals. We're going to define, and then I'll hand it over to our speakers, Adria and Veronica. Adria is going to walk us through defining the audience, kind of giving us some definitions about the aging communities that we see here locally and nationally. She's going to give some definitions on types of abuse. Giving a victim and abuser profile so we can kind of understand what that looks like. And then talking about risk factors and victim safety. And then Veronica is going to lead us through actually reporting and referrals, and then through resources available in the community. So that's our agenda. There's a lot to get through. It's a big topic. If you have questions, you can put them in the chat. I'll be monitoring that. And we may take some questions throughout the presentation, and we may save some at the end, depending on how the time is going and the flow of the presentation. I already introduced myself. I'm going to introduce Adria because she's starting us off. She's a program manager of the Community Resource Center for Aging at USC Verdugo Hills. She also holds a part-time appointment as associate professor with the School of Behavioral and Applied Sciences at Azusa Pacific University. And just over 10 years ago, Adria decided to study the responses to elder mistreatment while attending the USC School of Gerontology. She has published several articles related to the importance of working across professions to get the best outcomes for older adults. And Veronica Sigala oversees the LA County Workforce Development, Aging and Community Services, Adult Protective Services Program and Planning Division. Her division is responsible for developing APS policy for social work staff and the New Freedom Transportation, Home Safe, and LA Found programs. Veronica has over 29 years of LA County service, 25 of which were spent at the Department of Public Social Services. So we've got some really, we've got some great expertise with us on the training today. We're really grateful to both of you for being here. And then we also want to hear from you all. So if you could take a second to introduce yourself in the chat, tell us who you are, your name, your agency, and your role at the agency, and what you hope to get out of our session today. So take a couple minutes to do that, and I'll walk us through our training and our training goals. You could go to the next slide, Gretchen. So this is kind of the flow of the session as I described in the agenda. We're going to first talk about actually understanding and recognizing elder abuse. So if you were in a situation where elder abuse was occurring, that you would be able to identify it. And then we're going to talk about actually reporting that that elder abuse to the Adult Protective Services. And then we're going to talk about resources in the community and key partners. And really the overarching goal, if you could go to the next slide, Gretchen, is to understand how the protection of older adults is linked to elder justice, how those two are connected to one another. So without further ado, Adria, I'll hand it over to you to start us off in our presentation.
Great. Gretchen, can you go back one slide? I just wanted to make a comment about the idea of protection and elder justice. It's great to be with you today. I know this is kind of a downer, topic, but I think if we put on our capes and our crusader, sort of glasses and realize that we really are the eyes and ears in the community. It takes all of us as a village to kind of come together, and when people need to be protected, to do the right thing, right? And these are hard decisions. I've done a lot of supervision over the years with people that say, do I really have to report this? Oh, And so we want you to have this training today so you feel pretty clear about when you do and when you don't. We are thinking about people, in most of our work, we think about autonomy. And we think about, let's really honor this person's unique choices, right? And we want to do that. But sometimes situations get to a point where, the pendulum has swung too far over. This person can't make a good decision, perhaps, or there's some predators who have really taken advantage of this person. We need to step in and protect. So today we want to really help you know, when is it time for you to be a part of the team and protect people? And when it comes to elder justice, I just wanted to, I've realized that's what my whole career is about, is finding, ways to assess and come up with interventions that help people have quality of life as they age. So elder justice to me is a real broad definition. And I just wanted to point out a couple of initiatives at the state level. We have a California Elder Justice Coalition, which is easy to Google, Elder Justice Coalition for California. And there's a lot of good stuff there, including a really good definition of elder justice. And then at the federal level, we've been really lucky. Shelley Jackson has headed up an initiative, the Elder Justice Initiative. And so at the federal level, there's a great website where you can learn all about teams and different ways of being supportive. You can locate teams in your area. So it's a pretty cool website. So with that, we'll go ahead and jump into this topic. I have some real basic duties today, and I always like to know our audience. So I think about all of you in this sort of sphere of working in homeless services as pretty broad, because you've got people, sometimes we're working on, vulnerable people where we want to prevent them from becoming homeless. Other times we have people that are, excuse me, unhoused. I'm going to do a sip of water. And maybe they've been unhoused for over a year now, right? So we're looking at the Housing First initiative, working to get them housed under some shelter. The other group would be serving those that were formerly homeless. So how do we sustain people in the environments that we set up for them? So if you look at this A, B, C, and D, can you pick the group that you think you're serving? Are you serving to prevent homelessness? Are you working with unhoused folks, the formerly homeless, or some other group that I haven't mentioned? So in the chat, oh, I see A to C. So we have a lot of folks starting to enter in there. That's great. A. Is that making sense to people? Great. So we like to know our audience and kind of have a sense of who you're serving. So it looks like a lot of you serve sort of the gamut from people that are likely to go homeless to people that are trying to stay in their homes following a homeless situation. Okay, so let's move on to get to some nitty-gritty here. So just, it's always good. I mean, we all know the statistics, those especially that work in the sphere of working with older adults. We know that, you know what, population's growing, right? I think for me, I like to have some kind of a stat at my fingertips to think about how can I explain this to others. So in about the next 10 years, we're going to see that about 1 in every 5 people in a room is someone that's 65 or older. So we know through the administration on community living that there's a 19% likelihood of someone being 65 or older. And this is set to be 2030. So we'll see how that goes, because, you know, things that impact this number are things like immigration, of course, our coronavirus, all kinds of interesting, you know, period effects going on right now. But this is a pretty good estimate, a pretty conservative one. The second statistic that I think is really important is that I'm sorry, if you could go back, is that the National Institute of Justice estimates that about 1 in every 10 adults 60 and older is the victim of elder abuse. So I know as a longtime social worker, I didn't think that this was a very common thing over the years. And then boom, when I got more educated and learned about elder abuse and elder mistreatment, I learned that it's a pretty darn common thing. So we need to always sort of have our eyes open looking for these situations that meet the definition of elder abuse. Next slide, thank you. So another important study that was done in New York helped us with this statistic, which was really to understand that for every 24 cases that are out there where abuse has happened, likely only 1 of them gets reported on to the experts you're going to meet today. So you know, those that work in adult protective services, they know that they're just seeing the tip of the iceberg, right? Okay, so next slide. This is a definition that came out of some work done in 2015. There are lots of definitions of elder abuse because basically there's a lot of statutes that define it by state. So we have sort of more federal, more overarching in California. So I picked this one because I think it's a fairly general definition that this Elder Justice Roadmap Project put together. Basically, it says that elder abuse is physical, sexual, psychological abuse, as well as neglect, abandonment, and financial exploitation. So not to be so basic here, but I kind of want to read that to you because isn't it broad? I think we're talking about a lot of different things when we say the words elder abuse. Basically, this can happen in a care facility. It can happen in a home. It can happen when you live alone, when you live with other people. So it might be that it happens when you're in a relationship where there's an expectation of trust. I wanted to say trusted other. We say that a lot. Do they have a trusted other? But you know, when there's some expectation of trust, and then wow, that person actually was taking advantage of me. They might have been manipulative, right? Also, when an older person is targeted. So we know there's lots of scams. Anybody who gets, you know, robocalls at home knows that there's a whole group of predators out there looking to target vulnerable older adults and people with disabilities. So what helps me a little bit when I think of this big topic is to think about sort of 3 buckets or categories. So we've got sort of physical, sexual, psychological abuse. And, you know, I almost think too of put the lens of culture over this, and style of interacting and communicating with others. I think that, there's folks that are more at risk at these different types of abuse. You've got physical, sexual, psychological abuse as sort of a bucket of all different types of themes and issues that happen. You've got neglect and abandonment. So people that aren't getting a lot of attention, not getting a lot of people in their life. And then financial exploitation, which is a host of a lot of different things, including fraud and undue influence and a lot of different themes there. So these are kind of the buckets I keep in mind. So one of the goals today that we have for you is to be sure that you recognize forms of elder abuse. I think it can be kind of confusing, when a daughter comes along and takes over the deed to their parents' home, you think, well, maybe that's what the family set up, but that's what they want. But then you go on to learn that the family never knew, the parents never knew they were giving their house to their daughter. And perhaps their daughter has a host of situations going on in her life that make her, very needy for that deed to that house. So you begin to go, whoa, actually, that's a form of elder abuse, right? So it's sometimes kind of hard to pick up. So we want to be sure that you think of all the multiple forms. And in addition to just thinking about, one type of abuse, because sometimes something will come to light, somebody figures it out. But you know what? Anytime abuse comes to light, there's usually some other abuse going on as well. So just keep in mind that when you undercover or you find elder abuse, you go, what else is going on that might be abusive here? Okay. I know when I fill out my forms, I often check more boxes than one, right? So just to kind of go through here, I think depending on our experiences in life, what we've come to kind of experience as normal, we might be unclear sometimes what is actual elder abuse. So first we think about the population, so these things, when they happen to someone 65 and older, or someone who has some disabilities that make them vulnerable, then we begin to look at these types of activities. So if you've got that kind of person, and there's physical abuse, something like hitting, slapping, pushing, shaking, kicking, burning, cigarette burn, something like that, then you know that this is physical abuse. It also could be something like the inappropriate use of drugs. So sometimes people are in care facilities and they don't wake up very often because they're being overdosed, right? There's people that are in restraints unnecessarily. Most restraints are unnecessary. So unless you're in the emergency department with a team around you getting you calmed down, you probably aren't supposed to be in restraints. Also, I've noticed people that are having trouble swallowing, things like that, they might be forced to eat. And this can be physical abuse, forcing someone quickly to eat bites of food. And of course, things like strangulation, suffocation, with the pillow, things like that. These, of course, they're very upsetting, and these are all forms of physical abuse. So our next category is sexual abuse. And, when we see studies, we see that we would think only a small percentage of sexual abuse occurs. But between you and me, I believe that there's a lot of cases that we never know about. And so it's important to know, what is the definition? Non-consensual sexual contact of any kind with one of these individuals that I mentioned. So it's any unwanted sexual contact, or sexual contact perhaps with a person who's unable to give consent. So think about people that aren't able to make decisions, and they're forced to have sex with somebody. So this would fit under the sexual abuse category. So I love seeing, feel free to add things in the chat. We've got a lot of expertise in the room today in the gallery. This next area, category of elder abuse, is emotional abuse. And sometimes this is an area where we kind of have to sit and think, do we refer this on to adult protective services or not? But generally, these are the kind of issues that we're talking about. When somebody inflicts comments and ways of kind of psychologically distressing somebody. It might be some verbal threats, something nonverbal in their actions, but they upset the person in a very deep way. It could be a systematic perpetration of malicious and explicit non-physical acts against a person. So, different ways of kind of in the environment, emotionally abusing them, and then out and out making threats. So, the most common one we hear with people up in age that I think they have their antennas raised to would be that they're going to get placed in a nursing home, right? If you don't do what I say, you're going to be placed. I'm not going to take care of you anymore. So these are the kinds of emotional abuse we're talking about. Another area that isn't always discussed as much is spiritual abuse. So I think when we think of a biopsychosocial, all the things in the social category come to light, right? So things in your cultural tradition can fit under this idea of spiritual abuse. So it might be, keeping someone from practicing in some kind of tradition that they have, maybe going to church or going to a synagogue. It might be some kind of ceremonial items that they wish to hold or keep, maybe a rosary, or maybe they had some curandera kind of artifacts that they feel are important to have. And so it might be the person is belittling them or ridiculing them because of their spiritual beliefs. And then, of course, using a person's spiritual belief as an excuse to engage in abusive behaviors. So these are all kinds of variations of the theme around spiritual abuse. Neglect. Now, I know some geriatricians who have told me that neglect gets neglected. This is an area where there's a lot of hidden abuse going on. So we really have to be watching for this. This is the deliberate or negligent isolation of a person. It's also the refusal or failure to fulfill any part of a person's obligations or duties to an elder. So, people that need support and help, for example, maybe they're incontinent, and they're having accidents. And so not coming to their aid when they can't take care of themselves in that situation in a reasonable amount of time, right? Everything's reasonable. There's issues that come up. But when you don't attend to somebody like that, it would be a case of neglect. This can also be neglect occurs sometimes in financial matters. So, you can have people's resources being drained, right? Where their savings is dwindling so quickly. And that's because the person has not kept their fiduciary responsibilities for that person. So this is also a criteria that's included in the state's Home Safe program. So we're going to hear more about that in a little bit. Another area that I think gets left out sometimes is this idea of abandonment. So this is actually, sometimes it's because a caregiver is not suited for the role and they just can't take it anymore. They actually have gotten to a point where they walk out on somebody that needs a lot of help and that's dependent on them. So it's the desertion of an elderly person by an individual who has assumed responsibility for providing care. And or it could be the desertion of an elderly person by an individual who has physical custody of that person. So a lot of times in documentation, we'll look in a hospital document and say, who agreed to take care of this person when they left the hospital? And if it was a daughter, a son, a friend, a neighbor, whoever that was, if they can't do it, they have a responsibility to turn it over to somebody else or to let Adult Protective Services know it's not working and I'm out. I can't do it. You can't just abandon somebody, right? And then this category of financial exploitation, I mentioned to you, this is a large bucket, lots of different things going on. And what we mean by this is the illegal or improper use of an elder's funds, property, or assets. So sometimes people say, well, they don't have any savings, or, there'll be kind of excuses that it can't be financial exploitation. But if there's assets, there might be, artifacts like jewelry and things like that that are being sold off. It could really, there are a lot of variations on this theme. And there's been a lot of recent work by a colleague of mine around fraud. And so there's some new tools that we're using to help people avoid fraud. But fiduciary misconduct or wrongdoing, such as somebody has power of attorney or a conservator is not taking good care of somebody's resources, not using them for the person. This all kind of is what we conjure up when we think of financial exploitation. So I think about all the variations, and we have experts on the line today who have seen it all, have over the years, been with these programs for a long time. So I think it's just important to a few things that you can kind of keep in mind is that a couple where they've had a lot of intimate partner violence over the course of their marriage, watch that situation as they age. That can be abuse in later life, right? And then it kind of changes. I remember working with a couple in their 90s, and he was abusive to her. And I realized that she was an elder abuse victim, where they didn't see themselves that way because this had been going on for many years. So abuse in later life, abuse of vulnerable adults. So this is important to think about those that have intellectual and developmental disabilities. So people that are 18 and older. This is also, sometimes there'll be schemes where people are all taken advantage of. Their finances, for example, are being kept by somebody and they're being moved into a similar place. So there's all kinds of issues that can happen to those individuals that are vulnerable. So then all crimes against persons age 60 or older are called under the criminal justice system. And then self-neglect, thinking about, this is actually an area where there's a little debate in our field because we talk about elder mistreatment being the kinds of abuse that people do to an elder. And then there's actually self-neglect, which in our statutes gets included in elder abuse here. And this is people that are living without basic needs or they're refusing help. Their world has gotten beyond them, right? And so we often come up against these people, especially when we work in the homeless services field. So I think I just like to, point out we're a pretty diverse group today. And those that are victims of elder abuse, they're pretty diverse too. There's equal opportunity to be a victim of elder abuse. It doesn't matter if you're rich, poor, what gender you are, what culture you are, what language you speak, how impaired your thinking is or not. We're all susceptible, and all different living arrangements as well. So just keep that in mind that older victims are diverse. So, we're talking a lot about the survivor or the victim of abuse, but it's kind of interesting to think about who's actually perpetrating this abuse. What are the characteristics of abusers? And there has been some research on that, kind of looking at who actually carries out these things. Because I think for most of us in our walks of life, we think, oh my God, how could someone do this? Well, it's so interesting because sometimes, situations present themselves. And so often a person of trust, like a family member, a spouse, a caregiver, they're presented with situations that perhaps, where they decide they're going to actually cross that line and take advantage. So these are often persons of authority. And so when I think of persons of authority, it could be your pastor at church. It could be your doctor. It could be your attorney, your financial planner. There are bad actors in every profession and field, right? So, so oftentimes it's somebody that we think we can trust. And I've seen different percentages that, obviously a whole bunch of abuse takes place by people we know and trust. Maybe 2/3, we don't know. It's kind of out there as a murky number. But of course, we know there's a lot of abuse by strangers. So, the person who's a little cognitively impaired that's out with their shopping cart in a grocery store parking lot, they can be, targeted, right, by some stranger that says that they actually know you and they're going to help you today. Let me help you with that. I'll follow you home. I'll be your friend. So there's a lot of strangers out there, and then actual, using technology. There's a lot of perpetrators in that realm of stranger abuse as well. So some of the risks to consider, it's been so interesting during the pandemic, right? We've sort of had this unveiling of problems that exist, and one of those is isolation. So, that's a big risk factor. When people are isolated, I've been very interested in sort of people that are isolated that have a little bit of cognitive impairment, just a little bit. So they're living on their own. They think they're doing okay. They're very susceptible, and they can be taken advantage of and get into bad situations. Geographically, I've learned too, I got to do a project in Tulare County where, I think in LA County, we don't see as many rural areas, but when you go to some of the other areas in California, you realize that people that are in a rural community, they're out, on a farm somewhere, extremely high risk for self-neglect situations, right? Those with privacy issues, so thinking about close-knit communities where there's really an insulation, where people don't hear a lot about what's going on in there. That can be a protection, but it can also put you at high risk for abuse. And then economic stressors. So those that have limited financial resources, might be willing to take on some kind of a risky situation and might agree to something. Also, people that have a lot of resources might be targeted, right? So these are some of the areas when you think about risk to consider. So I've heard from, I know Ralph's on the call today, Veronica. I think about, what we do to protect these folks. And it all needs to circle really around the idea of victim safety. So all reactions and interventions, we consider and prioritize victim safety. So keep that as sort of a key thing. When do we get involved and how do we be involved? We want to make sure this person is safe. Some of the negative effects of abuse have been startling, and we've had some really good research. It's interesting, in the last, I would say almost 2 decades now, we've had a number of researchers really focus on definition of abuse and, and prevalence of abuse, and then looking at the effects of abuse. So we're not talking about, something minor here. We're talking about life-threatening. We're talking about, the whole range of negative effects. So certainly we know it can cause distress. And we have researchers that have shown higher levels of psychological distress and lower perceived ability to manage on their own. So somebody takes advantage of you, it's really hard to feel that sense of agency, that sense of autonomy again, because you've been duped, right? You've been taken advantage of. Certainly we know with physical abuse, there's a negative effects on your body. It could be, your joints, your bones, you can have broken bones. It might be digestive problems, depression, anxiety, things that aren't as seen on the outside. It might be chronic pain. It might be high blood pressure and heart problems. These all have been shown in research to be negative effects of abuse. But I think the one that really hits me is Mark Lax is a geriatrician in New York, and he and some other researchers have found that evidence shows that you have a premature likelihood of dying 300% higher compared to non-abused persons. So it's actually life-threatening, right? So how do you begin to find out what's going on with somebody? And I think this is important for our audience today, because you work with them with maybe some different foci, some different areas that you're really needing to target. But if you find it, you start recognizing some of these issues, consider asking if they feel safe. And just being direct with the statement, is anyone hurting you or scaring you? Is anyone asking you to do things that you don't understand or that make you feel uncomfortable? Has anyone taken things that belong to you without asking? And I know some of you may be going, oh, I see this all the time. Of course, they're taking your things. If you live in a close environment, in a shelter environment, things like that, obviously there's a lot going on. So think about their personal safety. If they had a large amount of their resources with them, obviously that's really important to get to the bottom of and see if we can right that wrong. Do you rely on anyone else for help? What kind of help? And does that person ever fail to give it to you? So I like this last set of questions because I think we miss this one sometimes, is the people that are being neglected, that really aren't getting what they need. And just a reminder that, who's listening to your conversation. So if you're in a setting where you can get to a place where it's more private, that would be advisable. When we do home visits, we often will ask somebody else to leave the room so we can get some good information. We want the person to feel safe and trust us with this information.
Adria, I have
Yes.
a question that kind of pertains to this slide.
Sure.
We had someone ask, with folks being virtual now and not necessarily being able to come into the facility, like for folks who are in facilities, what kinds of questions would you ask somebody in that context, when they are in a different place than their clients?
So they're sort of over Zoom maybe with their client?
Or over on a phone call, but they're not actually there to see the facility or to see the potential signs of abuse.
Yeah, so I think the questions become extremely important at that, because of the telehealth and teleservices that we've had to do, where we have little ability to go into the environments. I do see this opening up, and I've been able to get back out and do some visits now. So hopefully we're moving through this, but I think it's been important to ask, if it is a time that they can talk, because often they're in environments where there's people that you can't see. But then I think these kinds of questions will help you get at sort of those tips of the iceberg, see if you can begin to get some traction. And I just think they get left off sometimes when we're asking lots of questions in our work, but we maybe don't ask things like these questions. So as you listen and you hear some red flags, we just want to encourage you to go ahead and ask if they feel safe, ask if they're concerned about having enough help, and if they have things that are missing, etc.
Great. And we have one other question about pertaining to the slide about what kinds of questions would you ask if the person has dementia?
Yeah. I think you're very limited when you have someone, depending on where they're at with dementia. We don't want to rule out, that people with dementia can't be a part of this screening. Certainly people in the early stages can be very reliable in the sense that they know something bad's happening, or you can view them, visually, see that things are not going well for them. And we're going to actually have some input from the folks on the line today. But I think that, what I look for is to find sort of a surrogate person that I can talk to. So it might be that you're focusing on who else is involved in their world, and will they consent for you to talk with them? Because I think you might want to get to some other folks. Now, you always realize, that could be somebody that's taking advantage of them. You don't know if that person's going to be someone that can be reliable in helping you screen, because they might be actually involved in some kind of abuse. So there's a lot of variations. Veronica, is there anything else you want to add to just things that they should ask?
I was thinking about the same thing when I saw the question come up about the dementia. It's really important to, and I know that during a telephone call, you don't get the information that you would desire, but if there's any way at all possible to actually do a home visit for that type of person with that diagnosis, I think would be best, because they can tell you one thing and not understand what it is that they're conveying to you in the first place, because of the fact that they have dementia. And so to the extent possible, I think a person such as a social worker or someone else from an agency would also need to talk to different contact information for that person, even outside of the family, because even, perpetrators can be people within your own family sometimes, unfortunately. So it's just, it takes it to another level that is really difficult in my perspective. I don't know if maybe Maritza, who's on the line, can share a little bit more information, since she was an APS social worker in her career and probably dealt with this issue firsthand.
I'm thinking, why don't I just have a couple more slides and then I'll turn it
Okay.
over to your team, because I'm hopeful today, those of you with us today, that we'll have some time to have these conversations in a little more depth. But you're living some of the same complicating situations that we are. It's complex, right? And I do feel that people with cognitive impairment really need special attention. And so we have to look at, who's on the team, who can we bring into the mix? Is it their physician, other folks that can be a part of helping us get a better sense? So we'll move into a little more of that in just a second. I think we're done with that, because yeah, I think anytime you have suspicions, and I was thinking about that too, if you think, wow, this person's pretty confused, they're really having a lot of gaps in memory, and I wonder how this is working out at home, that might be somebody you need to report. Certainly you have to think about, do they have enough support? So certainly in life-threatening situations, you have to call 911, and you need to get somebody to do a welfare check right away to see what's happening. Sometimes we refer individuals to domestic violence or sexual assault organizations. That's a little different than what we've been just talking about, obviously, but there's reporting and referring. So the slide is kind of dealing with both. So if it's something life-threatening, we call 911. If we are feeling like this needs to be investigated, perhaps urgently, or could wait a few days, we refer to Adult Protective Services as well. So, or in not doing both, right? You might do 911, and you might also make a report to Adult Protective Services. And then you also have the option, if somebody is in care, in a licensed care facility, you can report to the licensing department for that particular care facility. We have sort of three different areas there. If you think about referring to, people that can kind of wait and need support, they get that through these domestic violence or sexual assault organizations. They get it through Aging Network. The whole Aging Network is a lot of services and supports in the community that folks like myself, I refer, people to different programs. And then the workforce development, Aging and Community Services, or WEDACS, will refer to our team today. We think about all the different services that they have. They really orchestrate a network of aging services. And I just looked at the website. It's new to me. I don't know how new it is, but the WEDACS website is terrific, because you can link to actual providers in different areas. And then we have our local ombudsman through Wise and Healthy Aging, and they help us with looking into situations in long-term care. So you sort of got urgent reporting, and then you've got referring to different organizations. And we'll talk a little bit more about, when you need to petition maybe for the public guardian to investigate as well. I saw that in the chat box. So the ombudsman, as I mentioned, for long-term care, they're involved in care facilities, and they will respond to people that live in those environments. And this is the contact information for them. It's a kind of easy number if you think of 888-334-WISE. And again, it's Wise and Healthy Aging out in Santa Monica that has a contract to do that work in our county. And then for community-based folks, we have our team on today, and they are through the Adult Protective Services Division of Workforce Development, Aging, and Community Services. And so you can call them. They actually have a portal, and they can tell you a little bit more about that too. But sometimes I need to call, and I'm just not sure, should I make a report or not? So you can call the number here, 877 for our seniors is the way to remember that line. And they're local here in kind of central LA near Wilshire area. So we'll have them talk a little bit more, but this is where you begin an investigation with Adult Protective Services. So this is the umbrella, isn't it, that Veronica, that you oversee the vast group of folks, and I'm so glad you could bring some of your team on today. And so I'm going to go ahead and turn you over to Veronica. I hope I haven't been talking too fast. I'm looking up at the clock, but we'll have time at to kind of go over some of the situations you've been putting into the chat. So thank you.
Thank you so much, Adria. And I think that's a great segue into Veronica's presentation. And she has a team of folks with her that I'm hoping she'll introduce. And I just wanted to flag that we got a couple of questions in the chat about self-neglect. So I'm hoping that in your presentation that you can kind of raise that up a little bit. And we got a question about any differences in reporting when self-neglect is the cause of the abuse, and also resources for folks that are in self-neglect situations where they decline services, and any assistance or guidance that you would have in situations like that. So I'm hoping that you could kind of raise those up as you're going through your presentation.
Thank
Thanks,
you,
Veronica.
Ilana, and thank you so much, Adria, for all that fantastic information. A lot of the information about Adult Protective Services was covered in Adria's fantastic presentation, but I do have with me today Ralph Pasquale, who is a Human Services Administrator in our division, and he is the individual who is responsible to train our social worker staff, especially those that are new into the county and into our department, on the various ways on how to report Adult Protective Services, how to recognize abuse, and also provides a plethora of resources to our staff so that while they're out in the field making home visits, they're able to use those tools to their advantage so that they can try to assist our vulnerable population as much as possible. So at this time, I would like to introduce to you Ralph Pasquale. He will be talking about self-neglect cases, as that is one of the most overlooked, I would say, types of abuse, because people don't really think about self-neglect as a form of abuse, but it all actually unfortunately is. And also he will talk to you more about the complications surrounding our program, whereby we don't have the authority, unfortunately, to place someone in a home facility or a care skilled nursing facility, for example, because of self-determination. So with that information, I will turn it over to Ralph. And Ralph, once you're done, if you can turn it back to me, please. Thank you.
All right. Good morning, everyone. Thank you for the intro, Veronica. I'll try to cover as much as I can, because the thing is, I probably will be talking more in generalities because there's so much to cover. In terms of APS, I just want to highlight self-neglect because Veronica has touched on it, and also Adria has already touched on it. Probably self-neglect is one of the most, well, not probably, it is one of the most reported types of abuse. And it's the only form of abuse that does not have a perpetrator. Self-neglect occurs, and I think Adria has touched on this, and I may be repeating what she said, of course, when an elderly person or a person who is a dependent adult threatens their own health or safety by failing to provide themselves with adequate hygiene, basic necessities met, and safety precautions. As far as I'm concerned, self-neglect cases are probably the most difficult. They're probably the most complex cases, mainly because of the client's right to self-determination, which is the crux of APS work. Sometimes it's really difficult, especially for newer APS social workers, to walk away from a situation if the client declines services, because the thing is with APS is a voluntary program. That means they can decline services or they can accept the services. So as long as we deem them to have the capacity to make decisions, unfortunately, sometimes we have to walk away from those cases. However, in many cases, we provide resources. Those resources, so those referrals can, the clients can use or not use them at all. But yeah, and just to pretty much illustrate the crux of APS work as far as self-determination is concerned, I always like quoting Albert Einstein. Albert Einstein once said, as long, when somebody asks me to wear socks, I don't have to. And that's very typical Albert Einstein. And that's pretty much the crux of APS work, is that, yes, we can only make referrals, we can only suggest to the client, but ultimately, as long as they're deemed to have the capacity to make decisions, it's their decision. So if they say, I don't want any of your services, unfortunately, that's what happens, is that we just leave the client be. So, and that sometimes though, it's very difficult for the public to understand that, but that's what it is. However, there's a couple of caveats to self-determination. One is, if the social worker suspects a crime was committed or has been committed against a client, the social worker will cross-report that to law enforcement for the investigation. Okay. And another caveat is that if it is obvious that the client does not have capacity in terms of making their decisions, then we will refer that case for further cognitive assessment, just to ascertain that the client has capacity to make decisions. Okay. Moving on.
Ralph, I just have a quick question about that before you move on. We had a question: how many attempts from APS to help clients before? Sorry, let me start over again. In self-neglect cases, how many attempts does APS make before closing the case?
Adria just answered it.
Oh, I see.
It is 3 home visits or 3 home call attempts typically. However, depending on the situation, really, because some cases may be at higher risk, mainly those physical abuse cases. Again, it's case by case basis, really depending on what the situation is. But typically, though, we will attempt 3 home visits. Yeah, and usually we respond within 10 calendar days of a case. However, if it's a case that needs to be responded to on the same day, like our immediate response situations, then we go out on the same day, typically 2 to 4 hours within receiving the case, or for the most part, then it's pretty much on the same day. And since I'm already on the IR situations, what are some of the conditions that pretty much set the button as far as if we have to go out on that case right away? One is, if somebody is a victim of physical abuse, we go out on those situations. Somebody who might not have utilities, especially in this heat during the summer, we go out on those cases right away. Somebody who does not have food, somebody who might be, might be in danger of being evicted because of an abusive relationship within that home environment, then yeah, we go out on those cases. If I miss anything, again, without food as well, it's also an immediate response situations. So hopefully that answers the question. So in the next slide, this contains some of the examples of what questions you might want to ask the person. Also, when you do these home visits, you might want to observe also the client in terms of, are they depressed? Are they confused, withdrawn or isolated from family and friends? You might also see some unexplained bruises and burns. Also, somebody might be underfed, filthy, over-medicated or under-medicated. Somebody who might have bed sores. Believe it or not, bed sores are more common at home. Mainly because the reason for that is because you have informal family caregivers who pretty much has taken on the responsibility of providing care for their older adults who might need assistance. Because in the facility, it really happens much less in the facilities, because in the facilities are regulated. Whereas in the home environment, that caregiver might not be trained or equipped to provide care for that individual. And really, when I was out in the field, I've seen more bed sores at home than in any of the facilities I visited in the past. Let's see. There might be some recent changes in the banking and spending patterns of the client. Talk with the client, talk with the adult, and ask these some questions. Don't be afraid to ask questions, especially, again, an excellent form, a good form to discuss, a form of self-neglect is somebody who might have suicidal ideation. don't be afraid to ask. Like, what is your plan? What is your plan in terms of hurting themselves? In those cases, I would call 911 right away instead of calling Adult Protective Services first, because what happens in those situations is that we call 911 as well when somebody is immediately threatening themselves, trying to harm themselves. Let's see. Ask privately in an area where the client can actually speak freely. In some cases, when the suspected abuser is in the home and pretty much the suspected abuser is trying to impede our entry into seeing the client, we, for the most part, though, we involve law enforcement, so we can go into the house and interview the client in private. Let's see. As mandated reports, I want to underscore this. As mandated reports, I'm not sure if Adria has touched on this. As mandated reports, all you need to have really is reasonable suspicion. You do not have to have a concrete evidence. You do not have to ascertain that the client is a victim of abuse, because as mandated reports, all you need to have is reasonable suspicion to make a report to APS. The responsibility of proving that abuse took place actually falls on us, on APS. That's our responsibility, to prove that abuse has taken place or did not take place. So again, the responsibility that you have as a mandate report is that report that to us, report the incident to us based on reasonable suspicion alone. Okay. You will not be criminally or civilly liable for making a report in good faith. That's the thing with making reports to APS. And I'm not sure if I need to cover in terms of what are the penalties for not making reports to APS, because everybody's a mandate report, and really you should be reporting any suspected abuse. It's 6 months in county jail, or I'm sorry, 6 months in county jail or $1,000 fine, $1,000 fine. If the willful or willful unreporting of the case actually leads to the death or bodily injury of the client, then we have 12 months in county jail or $5,000. And I just want to remind everybody that elder abuse reporting is actually a personal responsibility, meaning none of your supervisors, none of your managers or anybody within the agency can stop you from making the report to APS, mainly because it is a personal responsibility. Okay. Let's see, next slide, please. Oh, elder abuse cases, they're so complex, right? And the complexity of these APS cases require a multidisciplinary approach. Our APS social workers do not work in a vacuum. They pretty much, I always use the analogy that our APS social workers are puppeteers. They're just pretty much like pull the strings and all that, because they're the ones really pulling the strings for the benefit of the client. So again, we don't work in a vacuum. We involve all of these agencies to assist our client. It really takes a village to help our clients. Law enforcement is one of our biggest allies. The DA's office, the Department of Consumer and Business Affairs. These are some of the agencies within the county that we also have MOUs with. So they assist us in helping our clients. So APS social workers do not work in a vacuum. Next slide, please. Here's what Veronica was talking about in terms of the limits to APS actions. Looking at this list, what I usually, because I also do mandate reporting in services to the community, the different agencies within the community. They always ask me, why even report? So what is it that APS do? Okay, well, those are valid questions. The thing is, as far as why even report, first and foremost, you're a mandate reporter. It's a mandate. You have no choice. Okay, again, just think about the penalties for not reporting elder abuse. Secondly, I think it's really more for the benefit of our clients. These clients do not have a voice. This is what we call a silent pandemic, or it really is pretty much it's a hidden crime, because a lot of these cases take place behind closed doors. And really, you are the ears and eyes of our clients. So it really will help our clients to have a voice if they are in danger, if they're pretty much being victimized by someone else, then you are the ones who make the difference in terms of making sure that our clients are safe and protected. And for the most part, and this is what Veronica's touched on as well, it's unfortunate that the majority of our cases involve family members. That's pretty much the alarming fact. It's true, but it's just alarming. Okay. In terms of writing psych holds, we do not do that. What we do is we defer to mental health. And that's another great illustration of that's the reason why we work collaboratively with all these different agencies, is that Department of Mental Health can assist us in writing a 5150 if the client's a danger to themselves or others. Law enforcement can also do psych holds. Again, if you have a good working relationship with law enforcement, then we can actually ask them to write psych holds as well. Again, it's all about the client's right to self-determination. We cannot impose anything on our client. And we can only offer services and we can only implement the care plan with the permission of our clients. Yeah. Next, please. And yes, Adria already covered a lot of these, but I'm just going to highlight a couple. One is the local MDT, the multidisciplinary teams. At a county level, we do have the Forensic Center. Every Thursday, we meet at the Forensic Center. What it is essentially then is that you do have a team of individuals from disciplines, many disciplines. You may have, it's literally a table. It's around, it's a table. And our APS social workers table their most complicated cases. And you do have the DA sitting at that table. You have our medical professionals. Dr. Mosqueda now sits at that table as well. It was Dr. Homeyer in the past. Now we have Dr. Mosqueda, who heads the Elder Abuse Forensic Center. And then we have BCBA, we have Genesis, we have mental health, we have the PG sitting at that table as well. So again, the most complicated cases that APS social workers have, they table them at that session. And they get a lot of suggestions and a lot of recommendations as far as how to go about some of those very difficult and very complex cases. Another one that I want to highlight. Oh, Adria, please.
Oh, I noticed somebody asked about the FAST team, and I don't know if that's still meeting. Do you know, Ralph?
No.
I don't think it is. That was about financial abuse, right?
Yeah, LA County does not have the FAST team anymore. Instead, we do have Elder Abuse Forensic Center. However, you have regional MDTs as well. I know one in I think it's in Verdugo Hills Hospital, somewhere in that area. I think they do have an MDT as well. So you also have regional MDTs. And then you have NAPSA, National Adult Protective Services Association. The overarching goal of NAPSA is to equip APS professionals with training so they can perform their responsibilities and duties very well. We have many of our APS staff who have gone through the NAPSA certificate program. And what it is essentially is that it just pretty much illustrates that they are very much competent in the job that they do. So again, it highlights the competency of our APS social workers.
Ralph, I have a question about collaborations and coordination across systems. One question from our participant was, for self-neglect referrals involving two systems of care, such as Adult Protective Services and the Department of Mental Health, how is intervention coordinated by said systems, and can reports be done to both systems simultaneously? But I would expand that not just to self-neglect referrals, but like other just referrals in general. Like, how do you coordinate with other county departments?
What happens then when a case comes to us and it involves if it needs to involve other agencies, such as, let's say, Department of Consumer and Business Affairs, we do refer those cases to them to actually provide additional assistance to the client. So we do have MOUs with some of these different agencies within the department, and we work collaboratively in terms of providing services to our client. So whatever the client needs or requires to make sure that the client situation is stabilized, then yes, we make a direct referral to those agencies. I hope I
Right.
answered the question.
Yeah, and in terms of reporting, there would need to be, each department would need its own report, or could they be done simultaneously? Like, if you made a report for self-neglect through APS, would that get transferred over, for example, to the Department of Mental Health, or would there need to be another?
Yeah, since all of the elder abuse cases are
Mhm.
pretty much reported to us to APS, we're the agency that you can
Mhm.
report all of the elder abuse and dependent adult abuse cases.
Great. Mhm.
But
So then,
however, let's say, and again, this is just pretty much, let's say somebody from DMH suspected elder abuse, right? In their home visit, let's say they went out to see one of their clients, then yes, they can actually refer it to us directly. I hope I answered that question.
yes, thank you.
And let me add, now I just remembered as well. Let's say within the same agency, such as yours, let's say you have 2 or 3 individuals who suspect, who pretty much all suspect that is elder abuse taking place for, with one of your clients. Again, it's mandated. Really, it's a it's in welfare institutions code, whereby really you just need to agree on which one of those 2 or 3 individuals, as far as who should make a report to APS. But please make sure that that individual that was designated to make a report to APS, make sure that that individual actually made a report to APS. Okay. So you don't have to make 3 reports in this case. You just have to make 1 report, but designate that individual as to who will be making that report to APS. Okay. Next, please. Okay. APS, we investigate cases, and I think this was already touched on, elder abuse cases that allegedly took place within the community. Anything that takes place in a facility that actually goes to the long-term care ombudsman. However, what happens then sometimes is that some of these cases are mistakenly reported to us. What happens in those cases is that we forward it to the ombudsman for them to actually handle. Again, there's no wrong door, but it's that sometimes what happens then is that if the case is actually reported to the wrong place, especially in some cases, time is of the essence, especially physical abuse cases. So it gets lost. And then we've already lost some time, especially again, when you have immediate response situations. Okay. APS receives about 4,500 reports on abuse each month. To put that in perspective, I think we only have 126 APS social workers. Is that a lot? You do the math. It is a lot. Okay. As far as mandated reports, again, like I said, you don't have to have a concrete evidence that the abuse took place. All you need to have is reasonable suspicion and make the report to APS. Again, the responsibility of proving that abuse took place or not actually falls on us, on the APS social worker. As far as the hotline, this is pretty much a 24-hour service, 24/7. However, there are also additional ways to report. Okay, one is contacting 211. We do have an MOU with 211 in terms of taking the reports from the public. I believe they're 24/7 as well. You can also send the SOC 341 by snail mail. Yes, we still receive mail in this electronic age. We do still receive mail. And also we have a web portal where the mandate report can make a report to APS. That can be accessed. It's a long link, but that can be accessed by going to our WEDAX website as well. So if you haven't visited the WEDAX website, please make sure you visit, because there are some great tips on how to recognize elder abuse. And also at the same time, there are ways to pretty much how to make a report to APS. And one of them is going to directly to web portal. Okay. As far as, yeah.
Well, can I interrupt you just one quick second? With regard to mandated reporters, I know there was a question about it. People asked whether or not it's a 24/7 responsibility for APS, and I answered that it's actually a 24/7 responsibility for any mandated reporter. And so I was hoping that you can provide an example other than county employees being mandated reporters, who else are mandated reporters so that everyone in the audience is aware?
Mandated reports can be, again, there's a long list of that. You do have law enforcement, you have hospital staff, you have, gosh, you have the clergy as well. You have in residential independent housing, because you do have staff there as well that work directly or indirectly with our clientele. When I say indirectly, for the most part, though, some people think because they're a custodian of a facility, let's say an independent living facility, the custodian does have some indirect interaction with our clients. They can also be considered as a mandate reporter. What else? Geez, there's a lot of them. Banks became also one of your mandate reporters of financial elder abuse. That was, I believe, in 2007 when they first became what do you call this? Mandate reports of elder financial abuse. The list is long, but these are just a few examples of who the mandate reporters are. As long, the definition really for mandate report is that if you provide services intermittently or pretty much on a regular basis, when you work with this population, then you are considered a mandate reporter. I hope that answers the question.
Thank you.
All right. Let's see. As far as the call center is concerned, what happens then is that all of the cases go through our call center. Okay. In the call center, what happens then is that we triage, or we pretty much determine if the case is actually a case that can be open and can be assigned to the appropriate office. So they make that determination in the call center, which is pretty much a centralized location where all of our cases come in. They will also screen for urgency. Like I said, the cases are, for the most part, are 10, we have 10 days, 10 calendar days to respond to the referral. When I say 10 calendar days, that means 10 calendar days when we receive the case, because sometimes it gets assigned to the offices maybe 1 or 2 days later, especially on a weekend. So it's really 10 calendar days. So the clock is ticking as soon as that case comes to our call center. Okay, and there again, it will be determined as far as the urgency of the case, such as if it's an IR, immediate response situation, or a 10-day case, or sometimes we also do have the no face-to-face cases. Okay, so next, please. Oh, these are interesting stats. What we're not seeing at this time is, because usually when I do my in service to the community, I have a graph that I show for when we actually first started tracking abuse cases from 2000 to the current year, the current fiscal year. From 2000 until I see 2021, until 2021, there has not been a decrease. It's been increasing. The trend is really, it's increasing every fiscal year from 2000. And the only reason I can surmise for fiscal year 2021 is because we did have the pandemic, and that pretty much put a stop or pretty much paused reporting. Otherwise, though, it's been increasing from 2000 up to the year 2021. So that's alarming, right? And I hate the word tsunami, a silver tsunami, because what it really indicates is because the influx of older adult population is pretty much a catastrophic event, which is not. Really what happens then, what happens is that, again, it's really all about perspective. We only see the bad side of aging in APS, when in fact, the majority of our older adults live a happy, normal life. We only see the bad things in APS, maybe because that's our job. However, the majority of our older adults enjoy really, wonderful and pretty much, healthy lives. Okay, but yeah, that's LA County for you. The caseload is huge. So I think that's pretty much it. Unless again, I'll probably address some of the questions a little bit later on. I'll give it over to Veronica.
Well, thank you so much, Ralph. I really appreciate your enthusiasm on this very critical subject matter. I hope that the questions that people asked were responded to. And if there are more questions, feel free to reach out to us. We can certainly provide additional information. But now we want to turn it over to our Home Safe program. I want to share with you that the Home Safe program was first implemented in 2019. And it was as a result of Assembly Bill 1811 that the state went ahead and passed. And so we were really appreciative because at that time, 25 counties were allocated money to implement a Home Safe program. And so specifically in Los Angeles, we received about $2.6 million to implement the program. And we worked in collaboration with the LA County, the LA Homeless Services Authority, which is commonly referred to as LAHSA. We partnered with them and their service providers to provide short-term homeless prevention services to our APS clients that were either at risk of becoming homeless or already homeless. So with that bit of information, I would like to turn it over to Juan Carlos and Maritza Gomez. Juan Carlos is the manager that oversees our Home Safe program, and he can provide you with the stats on this particular slide and then turn it over to Maritza, who will talk to you a little bit about the eligibility criteria, the outreach efforts, and also additional information on where we are going with Home Safe. So Juan Carlos.
Thank you, Veronica. When we talk about Home Safe, we are targeting two populations: older adults, dependent adults, who are APS clients and maybe already homeless or at risk of becoming homelessness. In those 2 years in those 2 years in which we implemented a program, we have referred 351 clients to the coordinated entry system when those clients are already homeless. For those people who are at risk, we have provided 661 referrals to LAHSA and the service providers. And out of those, 336 clients have been enrolled into the program to receive different types of supporting services in order to prevent homelessness. At this time, I would like to introduce Maritza Gomez, who is a dynamic team player and the heart of this program in coordination with LAHSA and the service providers. She will give you more in-depth information on Home Safe program.
Thank you, Juan Carlos. Good morning, everyone. A little more information with Home Safe. Like Juan Carlos stated, Home Safe is a program that is in partnership with LAHSA and all of their 8 service providers. We really wanted to make sure that no matter where a client lived in LA County, that they were going to be able to work with one of the service providers that we have partnered up with when it comes to Home Safe. A little bit information about the eligibility for the Home Safe program. You must be an APS client. You must have a current APS case open with us and also be experiencing a financial crisis when it comes to the housing for the clients. Some of those eligibility criteria involve receiving an eviction notice. It could be a 30-day notice, a 60-day notice, a 3-day notice. It can even be an unlawful detainer. I would urge you to refer anyone who is under those circumstances, even if it is an unlawful detainer, because oftentimes many people believe that we're not able to do something at that point, but with the collaboration with the APS social worker, the service providers, we are able to come together to assist the client the best way that we can. The other way that we've been able to expand our eligibility when it comes to the Home Safe program is that if a client is living with a family member or a friend, and the friend writes a letter or that family member writes the letter stating that the client can no longer continue to stay in their home because they're not in their rental contract, and at that point they're placing their own family member in jeopardy of losing their housing, then that will be a notice that the program, Home Safe program, can utilize in order for that APS client to also be part of Home Safe. The other part of being part of Home Safe involves with being rent burden. We do find that a lot of our elders really go without food or medication in order to pay their rent because they are so fearful of becoming homeless. So therefore, those clients that we see that 30% or more of their income is going towards the rent, and they don't have enough to pay for their food or their medication. Even if their medication is a $5 copayment, we definitely want to see those clients. Those clients are eligible for Home Safe. The other scenario would be if the client has received a letter of a rental increase and they know that they will not be able to afford that. Many of our clients are only receiving, they're on fixed income, they're only receiving Social Security or Social Security disability. Therefore, an increase in their rent really places them in jeopardy of becoming homeless. All of those are circumstances where the client, once they have an APS case open because they're going through any of the abusive situations Rob talked about previously, and they're also going through endangerment of losing their home, either because of the rent burden situation or because they have some sort of eviction, they can be part of our Home Safe program. The Home Safe program is a volunteer program, so we do ask that if you want to refer anyone to our program, you let them know that you are doing so, because the first thing that happens when I receive a referral, I am the person that sees all of the referrals when it comes to Home Safe. I look at the referral to make sure that it meets the eligibility criteria, and I make sure that the client understands that they're going to be part of the program. The second part that happens is that I connect the client to the service provider in whichever area that they live in. And once that happens, the service provider then gets in contact with the client to make their own intake and their own assessment and figure out what is the best way to help the client. And many times that means that the service provider will try to see if there's something that can be done with the current housing that the client has. Meaning, can they work something out with the landlord? If the client owes any sort of back rent, can the program pay for that rent in order for the client to stay in that home? Because as everyone knows, LA County really needs more affordable housing, and we don't have enough of that. So the first priority for the service provider really is to see if the client can maintain their home. One thing that I should point out is that the Home Safe program right now is only for 6 months, and the financial assistance includes paying for the client's back rent. If that is not something that is feasible because the landlord really wants the client to move out, we can provide security deposits for the client and move-in assistance when it comes to either the mover's transportation, anything to do with the client being able to move from one location to the next. We also provide assistance to pay the client's utility bills. And we only provide that assistance if we find that the client meets the criteria of being rent burden. And also in addition, most clients who are rent burden are also needing assistance with their utility bills, or those who are going through an eviction also need assistance with their utility bills. So the exciting part about Home Safe is all the financial assistance that we can provide to that specific client in order to prevent that eviction from happening, in order to prevent the client from really being homeless. So again, I think this is a great program. The great news is that it will continue. We have received funding in order for the program to continue for many more years. Well, not many more years, into 2024 as of now. But I will welcome any questions at this point. Something that I am forgetting to mention is that if you ever have a question about Home Safe, you can reach out to my manager, Juan Carlos, myself, everyone in the managing team here. We are more than happy to answer any of your questions if you're not very sure if the client qualifies for Home Safe, or if you even should make an APS report for a particular client. We often find that our Home Safe clients are really being abused by their landlords because they're being asked to leave and not being provided with the correct notice. They're giving our clients a lot of psychological abuse because they feel that the clients don't have anyone to advocate for them. So those are some of the situations that we often see when somebody is referred to our Home Safe program.
Thanks, Maritza. And I see we have a lot of questions coming into the chat, and I know we were ambitious trying to fit a lot of content into 90 minutes. And I'm really appreciative of our presenters for responding to some of the questions in the chat. So thank you for that. We will be trying to address some of the questions that weren't answered in our follow-up email. So that's going to be one resource. It sounds like all of our presenters are willing to share their contact information, so you can follow up with them directly for additional questions. So we have Adria and Veronica's contact information here, but we can also, it sounds like, share Juan Carlos, Maritza, and Ralph's contact information as well. So we have a lot of great resources for you. And there was one question in the chat about conservatorship. And I know we didn't, that's kind of a whole other sphere that we don't have time to get into today, but we did hold a training on conservatorship. Was it earlier this year or last year? I can't remember, but we can send out the recording and training content for that training as well. It was really great. Connie Draxler from the Office of the Public Guardian gave us a really amazing training. So we can share that information as well in the follow-up email. I know we have just 2 minutes left and I want to be respectful of everyone's time. So I want to open it up to the presenters to see if anyone has any closing comments before we finish.
I just wanted to thank Gretchen and you, Alana, for facilitating this presentation today. I know that there's a lot of information out there that was given, and we certainly welcome your feedback and any questions that you may have. We certainly welcome your referrals. Most importantly, if you see abuse or suspect abuse, make sure that you report it. We really appreciate that. And of course, we appreciate any referrals made to the Home Safe program. As Maritza mentioned, we just received a notification recently from the state that California will be receiving an additional $200 million for Home Safe. And so we will be getting the state will be getting 50 million in the next fiscal year and another 150 million for the following fiscal year. Los Angeles does not yet know what our allocation will be, but we certainly think that it'll probably be a little bit more than the original allocation of $2.6 million. That's what we're hoping. And so also for you to know is that Home Safe will be opening up to the additional counties. Currently only 25 counties have a Home Safe program, but eventually all 58 counties, that is the desire of Governor Newsom, to have all 58 counties with the Home Safe program. So we're really appreciative to our legislatures and everyone else for this opportunity to administer such an important program for our most vulnerable population.
Yeah, the Home Safe program is such a great resource, and it's a new resource that I don't think not everyone knows about. So we can
Correct.
include maybe if you have some materials that we can send out about how to refer to the Home Safe program or what kind of resources, like any materials that you think would be helpful for the attendees, that would be great as well. And we also will be sending an evaluation in the follow-up email, so you could, if you wouldn't mind completing that. And we're at 11 o'clock. So thank you so much to all of our presenters. I think this was a really informative training, and we never have enough time, but lots of great resources. And we hope that you can all connect offline as well. Thank you, everybody. Have a good rest of the day.
Thank you.
Thank you.
Bye.
Thanks, Maria.